Hello, this is Nina C10 again. Today I would like to talk to you about more about becoming healthier. I was a registered nurse in the Philippines, and when I was a nurse and had my training back home, I used to remember that was in the 1970s that we really take care of our patients. When they're sick, when they have a fever, we give them a sponge bath. You remember those days? To lower the temperature is to give a top water bath to the person, and you put ice here and ice here in order to lower the temperature. And when you do that, actually, you're very much in communication with the person and they see that you really care. But back home, then, because we allow the relatives to be at the bedside, most of the time the family gets involved with taking care of our patients. So, to lower the temperature, let's talk about fever. We do a sponge bath first, and then the doctor will order that if the fever doesn't go away, then that's the only time we give them something to lower the temperature, like Tylenol. And of course, the reason why the fever is not going down is because they have an infection. Excuse me. So back then, they will only give one antibiotic. But you know what? Our patients really get well and they only stay in the hospital for a couple of days. I came to the United States in 1982, and that was for a change, because I hear that America is the land of the free and also the land of the opportunity. And my father wanted me so much to come over to have a better life, he says. And I did. As I work in my first hospital, I noticed something. There were too many medications or drugs being given to my patients. And I began to question myself, is this really what it is? That was in the early 1980s. And then 1990s came, and I'll give you an example. If a person has diabetes, they will be given one drug to control the blood sugar. And then the following week, I'll be told, okay, this is another drug that is discovered or something. But what I was noticing was there was a drug almost every week new to be given to a person with diabetes. When I left my nursing, there were still a lot of drugs that are being given one after the other to one condition. So I really began to question my integrity and my self-respect. Am I doing the right thing for my patients? Because there's so many drugs after drugs, and then patients come back and come back and come back. I had the privilege to be working in an intensive care unit. And boy, it was frustrating because my patients had so many antibiotics, one after the other, that sometimes I don't even see my patients anymore because they're no longer there. They didn't go home, but they went down under. And I began to question myself, what is really going on? Do we really know what we're doing? But something changed in my life when I decided to leave my nursing, and that's when I met my husband, who is an alternative, holistic, and naturopathic doctor. My whole viewpoint changed because his practice has to do with making the body healthy. And he used to be a conventional medical doctor. Trust me, he's been there and he knows, and he saw the results of so many drugs to his patients that he was frustrated. He has to find something that will really help the patients. watch my other video because I'm going to educate you on how to live healthier so you can be happier. My name is Nina Sitan.